I'm Dr. Vohra and I'm going to talk to you about cervical screening. This is Cervical Screening Awareness Week, and it's a really important week to understand what cervical screening is and then the impact it can have on you. Currently, 1 in 4 women do not attend for their cervical screening call, and that's concerning. All women between the age of 25 to 64 are eligible to have a cervical smear test. This can be between a 3 to a 5-year interval. When you have a cervical screen, it's looking for cells around your cervix that are changing all the time. It's based on not knowing if you have any symptoms at the moment, and it's a screening test, so you don't have to have any symptoms or concerns at the time. It's important to feel empowered and aware of what's going to happen in a cervical screening appointment. Most women find this the most concerning part, and you can be really reassured. There's a set process that should be followed. You should be given capacity and privacy to change, and then have an explanation of what's involved. Normally we use something called a vaginal speculum, and this is what it looks like, and this is your visual and entry point to getting the smear test done. After this, you'll feel a slight little rotation of a little brush, and the sample is taken and sent away. When your results are processed, they're looking for 2 things. Firstly, the vast majority of cervical cancers are associated with HPV, which is called human papillomavirus. They'll be looking for that virus, and if that is positive, they will then do further tests on that sample. You may at that point be called back to a further assessment in something called a colposcopy clinic, and you should have explanation according to what that is. Sometimes, even if you have HPV, it can resolve and settle in its own accord, and you may not need any further treatment. So please don't be too alarmed if that's the case, and look through the information you're sent. If HPV is found, you may then be called back sooner or retested at the routine time of 3 to 5 years. Cervical screening is really important. It's a woman's opportunity to get an examination of her vaginal and vulval and cervical area, and also get the reassurance that at that present time there's no concern that might put you at risk of cervical cancer. There are 5 gynecological cancers, and cervical cancer is one of them, but that opportunity to get that examination and assessment is really important, and it's not something we should fear, and all women should be attending.